Which of the following factors is most likely responsible for the development of this patient's ulcer? Decreased gastric bicarbonate secretion, decreased gastric mucus production, increased gastric acid secretion, increased gastric motility, or increased gastrin production. A 38-year-old woman presents to the clinic with a 2-week history of epigastric pain, nausea, and vomiting. She had a severe head injury 1 month ago. On physical examination, she has epigastric tenderness. Laboratories studies show a mild leukocytosis. An endoscopy is performed, revealing a single deep gastric ulcer. Which of the following factors is most likely responsible for the development of this patient's ulcer? So the big thing that pops out to me is like this is a woman who had a head injury 1 month ago. And so I'm thinking that like, in head injuries, I think that you have like you have like this connection ability, this acetylcholine can increase gastrin production, gastric
Okay.
acid secretion, I mean. And so maybe there was like a connection there that where it's like constantly stimulating the gut to do that. And so right now my gut is leaning more towards increased gastric acid secretion. Um, and I don't know. That was happening today too. I don't know if that was a thing where it was
Yeah.
like you click an answer and like everything would just disappear.
Yeah. I'm going to mention
Oh,
this because we just released this today. So there's going to be some bugs. So,
oh yeah, no worries. Um, but that's kind of what I'm going with. I'm thinking it's going to be like that increased secretion of gastric acid. Um, Another thought I'm having is the gastric mucus production, but I'm leaning more towards gastric acid secretion, so I'll probably go with that.
okay. Increased gastric secretion. Okay. So come up with what's your diagnosis if you were to give me a diagnosis here?
It's called a curling ulcer, I believe.
Okay. Okay. Good.
And it's when you have like head injury caused like head injury induced gastric acid secretion is what my idea is.
Okay. Good.
A
Good.
Cushing's ulcer.
Cushing's ulcer. Curling is different. That's going to be with burns, right?
Oh, you're right. Yeah, curling iron burns you. Yeah, that's
Yep.
exactly right.
Curling iron burns you. That's the way I remember also. But Cushing ulcers is going to be a head injury. So going to increase gastric acid, right, due to increased vagal stimulation. But yeah, perfect.